Hello everyone, welcome back to UWorld's live NCLEX review. My name is Nicole. I'm a nurse here at UWorld, here to do another question drill set with you guys. Love to see you. A lot of people on YouTube are already in the chat chatting away, baddies in the house. So glad you guys are tuning in right on time. Sorry we are a few minutes late, but how a question drill works is I will pull up a question right above me, give you about 30 seconds to review the answers, drop in the chat what you guys think the answers might be, and then I will discuss why the right answers are right or the wrong answers are wrong, and get a better grasp of how to answer these NCLEX style questions. So we like to be and build a community in the chat, so don't be shy. We give each other hints and help and strategies, and we just talk amongst ourselves and get good practice in before your NCLEX. It is NCLEX season. I feel like a lot of people graduated over the holidays in December and are studying right now for their NCLEX and probably are about to take their NCLEX towards the end of the month. So way to tune in and get another study session in with us here at UWorld. Today's topic is most missed questions. So it's a little bit of everything. It's a lot harder, I would say, because these questions might have to do with tricky concepts, or you might have to use multiple strategies to get the right answer. So don't be afraid, don't be shy. If you are going towards the wrong answer, it is a little tricky, but we're in this together and we're going to learn. So without further ado, let's get started. Question number 1. The nurse is screening pediatric clients for autism spectrum disorder. It would require follow-up if a what? Option 1, 9-month-old client has not developed a strong pincer grasp. Option 2, 17-month-old client cannot kick a ball. Option 3, 24-month-old client lacks spontaneous eye contact. Or option 4, 36-month-old client cannot hop on one foot. Let me know what you guys think down in the chat. Hello everyone. Thank you also for everyone sharing and following us. I'm seeing some follows and sharing in the chat. We appreciate it. If you haven't seen, we finally reached our 100K subscribers on TikTok, which is amazing. Thank you so much for having us reach our goal. We're going to set up a new goal for this year, but thank you guys. Continue following, sharing us to all your NCLEX friends, your NCLEX, your nursing school friends, your whole cohort. Let us all be on this journey together. Hello, everyone in the chat. Love to see everyone in and talking, whether you're on Instagram, TikTok, YouTube, Facebook, restreaming. Love everyone being chatty in the chat. We're seeing a unanimous option 3 or C in the chat as well, which is great because that is the correct answer. Option number 3. So back to the question, it would require follow-up. So we're looking for something that is a wrong connection. So like with, in this case, the developmental range and milestone and age, especially when it comes to autism spectrum disorder. So autism spectrum disorder is a neurobiological and a developmental disorder. So usually don't start seeing some signs until they're a little bit older, maybe around the age of 3. And then there's many different caveats and different things that they assess it, whether it's impaired social skills, interpersonal communication and how they react and talk with everyone else, increase or decrease sensory input. Sometimes they have restricted activities or interest in certain things, or they have repetitive patterns and behaviors. So there's a lot of things that go into the full spectrum of autism. But there are some things that you will be able to see fairly early, which is option 3, 24-month-old client, so a 2-year-old, lacks spontaneous eye contact. This would be a very high indicator that they might be on the spectrum or that they might be having other developmental issues. A 24-month-old, a 2-year-old should be able to have some type of eye contact. Eye contact actually starts developing at around 8 weeks old. So if they're at 24 months, 2 years old, they are very delayed in that. So we need to follow up very soon to get that checked out. Options 1, 2, and 4 are all things that we could expect. A 9-month-old has not developed a strong pincer grasp. That is very hard for a 9-month-old. Pincer would be 2 fingers. They would have definitely maybe a palmer. Yeah, I feel like little kids at this age are palming and grabbing everything. So they would have a palmer grasp, but not a pincer grasp. A 17-month-old client cannot kick a ball. This is to be expected unless you got a D1 athlete on our hands. Having that coordination and the ability to be able to kick a ball. Same with the 36-month-old client hopping on one foot. That requires a lot of stability, agility, D1 athlete in the making to be able to do it. So it's not expected for that. But a 24-month-old client should be able to have eye contact because that should have been developed way, way earlier at 8 months or 8 weeks. I'm sorry. So let's move on to the next question. The nurse has taught a client with hypertension who has a new prescription for ramipril. Which of the following statements by the client would require follow-up? Option 1, I should discontinue the medication if I develop swelling of my lips or eyes. Option 2, I will avoid taking a potassium supplement with the medication. Option 3, I can continue taking the medication if I become pregnant. Or option 4, I may develop a dry cough while taking the medication. Let me know what you guys think in the chat. Thank you so much to Postin on YouTube saying happy 100K you world. We really appreciate it. Also in the chat, I want to start talking in here just and give shout outs to Miss Afro on TikTok, just passed her NCLEX today. Congratulations. That's awesome. Awesome, awesome, awesome. Let me know if there's any other recent NCLEX passers, or you scheduled to take your NCLEX in the next couple of weeks, or you're waiting for your ATT. Let me know in the chat. Let's get talking. Let's build a community. Let me give you a shout out or congratulations in the chat. Congrats to you guys as well. Good answer choices as well coming in the chat with some good rationales. Love to see it. Seeing some 3s and some 2s. We have Simran waiting to test. Patience is a virtue. Baby Ashley's waiting for her ATT as well. Theosia is taking hers on the 29th. Graduation was today. Congratulations for graduating. That's awesome. Someone's testing tomorrow. You got this. You got this. You're going to do great. Y'all are going to do awesome. Thank you guys for tuning in and getting some last minute studying in, whether you're taking it tomorrow, next week, or you're still patiently waiting to schedule. You're in the right headspace. Let's move on to the answers. I'm seeing a good amount of 3s, but some 2s. The correct answer was option 3. I can continue taking the medication if I become pregnant. So let's go back to the question and break this one down because it does have a couple of concepts that we need to know. So a client that has hypertension is prescribed a new medication, ramipril. So first things first, we need to figure out what ramipril is. Ramipril is an ACE inhibitor used to control blood pressure. So that is correct. But we need to know what that ACE inhibitor actually does to the body and if it can potentially cause any other complications. So ACE inhibitors, they are actually contraindicated in pregnancy because they have association with fetal renal injury and they can cause some malformations with the fetus as well. So clients that are taking ramipril even way before they are pregnant or even maybe trying to have a pregnancy, their medications are always assessed because you don't want that in their system at all. So we would want to switch that medication up to another type of antihypertensive medication so it wouldn't be in their system and not cause any fetal harm. So ramipril or any other ACE inhibitors is definitely contraindicated with pregnancy. It is a teratogenic medication. All the other options, options 1, 2, and 4 are correct feedback or teach back things that the client is saying. I should discontinue the medication if I develop a swelling of my lips or eyes. This is actually sometimes common as well as with another type of medication. I always forget. But angioedema. You can have angioedema of just the tongue, or it can actually go to your lips, your eyes, and your whole face. So if they also develop a dry cough, that is also a type of allergy or intolerance to the medication. So they need to discontinue the medication. Option 2, I will avoid taking a potassium supplement with the medication. This is true because ACE inhibitors actually can sometimes increase your serum potassium. So if they're also taking another potassium supplement with a medication that increases the serum potassium, they're going to have a very high potassium level in their blood. And we all know high potassium levels can be very lethal because it can lead you into dysrhythmia. So they should avoid taking a potassium supplement. So that's good teaching. Option 4, I may develop a dry cough while taking the medication. Again, this is showing an intolerance possibly. Sometimes that dry cough is nagging and they want to be switched off. So that is a correct teaching or feedback that they might say, and a correct understanding of ramipril or ACE inhibitors. But you guys did very, very good. Let's move on to the next question. The nurse is caring for a client with a new mechanical heart valve. The nurse should expect that the client will be prescribed what? Option 1, Warfarin. Option 2, Delegating. Option 3, tacrolimus. Or option 4, apixaban. Let me know what you guys think in the chat. And be sure, while you're waiting for the answer choice and for me to move on, to subscribe to our channel, but also subscribe to our event calendar. Turn that notification bell on, whether you're on TikTok, Instagram, YouTube. So anytime we do go live with varying times, we might be switching up our times here soon, you will always be notified and you will always be within our question drills or study sessions. But if you go to uworldnursing.com, we have our full event calendar, so you can see a couple weeks out what we're about to be reviewing in the future, whether it's lectures, but then we also have fun question of the week where a question gets delivered to your email personally, so you can have some self-practice independently without anybody bothering you about what it could be. So practice yourself with the question of the week, but then also see our subscription packages as well as that on our website. I am getting mostly 1s. There's a sprinkles of 2s in there as well. Let's see. You have a new heart valve. What's your new prescription being sent to CVS, Walgreens, Kroger, HEB, Tom Thumb? Which one of the pharmacies? Good. I'm seeing some rationales about anticoagulant, but you need to be specific about what type of anticoagulant we might need. Be very, very careful. I'm seeing options 1 and 4. The correct answer is option 1. So a lot of people were on the right path with needing some type of anticoagulation medication to prevent clots from forming or for clots from getting bigger. So Warfarin would be our correct answer. This is an anticoagulant, but it's a specific one because it factors on the vitamin K. It's a vitamin K antagonist. So it's going to be breaking down this medication, but not medication, but that in the body. Another great point about Warfarin is it does have a narrow therapeutic range, but we are able to monitor this very, very quickly or easily. With the other medications that might also be anticoagulants, we don't have a good reference range to continuously monitor their lab level. So with Warfarin, we can monitor their INR level, which they go in very, very often for routine monitoring of that to make sure that they're not, their blood's not too thick or too thin. So I think that's why option 4 tricked a lot of you guys up. It's actually that factors on the XA inhibitor. They're not used for AFib or it's actually used for AFib and a treatment for DVT and a PE, but it's actually contraindicated with a heart valve. You don't want that on the heart valve and making that heart valve any less or more squeaky. So it can get onto the heart valve and cause some problems. So it's actually contraindicated with heart valve clients, even though it is an anticoagulant. Option 2, dabigatran. This is a thrombin inhibitor, also used for AFib and thromboembolisms, but it's also not recommended for heart valve clients. And then tacrolimus is an immunosuppressive agent, usually used for organ transplant, so not really needed in this case. But you guys did very good. Question number 4, the nurse is teaching a client who has a new mechanical heart valve and is taking the warfarin. So now that we prescribed it, now let's do some teaching about it. Which of the following information should the nurse include? Select all that apply. So maybe I said something earlier that you can use to maybe answer this question. If not, use your memory or use your knowledge on warfarin and the correct teaching points. Option 1, request prophylactic antibiotics before any invasive dental procedure. Option 2, notify your healthcare provider if you develop flu-like symptoms. Option 3, take naproxen to relieve minor aches and pains. Option 4, schedule routine monitoring of your INR. Or option 5, avoid using an electric razor to shave. It is a select all that apply, so there is more than one correct answer. And with select all that apply, a good rule of thumb / it is true, you will have more than one correct answer, but it's usually not ever all 5 of them correct. Hint, hint. Good job, guys. Seeing lots of 1, 2s, and 4s. Some people are adding 5 into that. Read the answer choices very carefully, one by one. That will be your hint. Read it very carefully, because sometimes those negative wording can trip you up. Cough, cough. Good job, guys. Guys with an S. I think y'all are catching on to my little hints that I am reading and are not including option number 5 anymore, and that would be correct. So correct options for this one would be options 1, 2, and 4. So we're looking for correct teaching points. Another strategy with select all that apply is to cover up the answers and go one by one and think of them as a true or false statement. Read them independently and think, is this statement all the way true 100% of the time? So option 1, request prophylactic antibiotics before any invasive dental procedure. This would be true. You have a new hardware in your heart. We don't want any infection or any problems or complications with this new hardware that we have in our heart. Because also, since it is in our heart, it can cause more crazy complications later on that could send you into like a full sepsis. So prophylactic antibiotics before any invasive dental procedure would be correct, because think of your teeth has and your gum line is very close to your bloodstream, or it can get into your bloodstream very easily if any nick or things happen, and then your mouth is very dirty, so easily that bacteria can go into your bloodstream through your mouth, and that could cause problems with your new hardware. So requesting prophylactic antibiotics to kill any bacteria that's in your mouth would be a correct teaching point. Option 2, notify your healthcare provider if you develop flu-like symptoms. Again, this is true because those flu-like symptoms, yes, being sick would be, you need to get treatment and antibiotics, but flu-like symptoms, especially with a heart valve, could be indicative of endocarditis, which is an infection of the pericardial sac, which could cause more problems, not just to your heart valve, but to the heart itself. So we want to prevent that from happening or prevent that from escalating. So flu-like symptoms, whether it's actually the flu or endocarditis, needs to be treated immediately. Option 4, schedule routine monitoring of your INR. This is like what I said earlier. When a client is on warfarin, it has a therapeutic range, kind of narrow. So they need to have frequent but routine monitoring to make sure their blood is not too thin or too thick to have this heart valve. Option 5, a lot of you guys chose this one, but then maybe backtracked a little bit. You have to read the answer choices very carefully, especially when they have a negative added to it. Excuse me. So avoid using an electric razor to shave would be incorrect, because we would want to actually encourage them to use an electric razor to shave. That is the safer option rather than just a plain straight blade razor, or what do they call it in here? Yeah, razors with straight blades. So we would encourage them. So that's why it's incorrect, because we want them. And then option 3, take naproxen to relieve minor aches and pains. Naproxen is an NSAID, and NSAIDs should not be given because it increases your chance of bleeding, and you're already taking warfarin, and that's another anticoagulant. So we're just increasing bleeding all around, and we don't need that. So they need to be taking Tylenol or something else instead to treat any pain. But you guys did very, very good. Love your rationales that you have. I saw a couple of people saying in the chat that they are sitting for the second time for their NCLEX. And we want to help you in any way that we can. So we have this special offer for anyone that is trying to take, or not trying, scheduled to take their NCLEX for a second time. All you have to do is go to uworld.com, uworldnursing.com, and scroll down where we have this NCLEX retake offer. Upload your CPR, your Candidate Performance Report that they sent you when you were not successful that very first time, and we will give you a discount of $20 off for a new 30-day subscription. So you might be taking your test in the next couple weeks, next couple months. Let us help you with this $20 off. A little goes a long way with your knowledge, okay? It's priceless at this rate, but this is for retakers only. So go to uworldnursing.com, scroll down to the retake offer, and submit your CPR form. Okay, question number 5. The nurse has taught the parents of preschool-age children about childhood growth and development. Which of the following statements by a parent would indicate a correct understanding of the teaching? Select all that apply. So again, go one by one, cover up the other answer choices, and read the answer very, very carefully. Make sure every point of the answer is correct 100% of the time. Option 1, I should notify our healthcare provider if my child is not toilet trained by 24 months. Option 2, I can expect my child to be able to sit quietly for at least 30 minutes at a time. Option 3, my child should be able to independently turn the pages of a favorite book. Option 4, my child should be able to communicate using at least 3-word sentences. Or option 5, I should encourage my child to assist with household tasks. Or you can put in on the work. Let me know what you guys think in the chat. Preschool age children. I feel like child development and all those milestones are very tricky for me, especially since I'm nowhere in the peds world. But there's just so many milestones, yes, that they have to reach at each age. So I can understand why they are frequently missed, most missed questions. Someone says, I can't see the full question. I will read it again for you. The nurse has taught the parents of a preschool-age children about childhood growth and development. So we're looking for answer choices about preschool-age children and if they're making that milestone. Which of the following statements by a parent would indicate a correct understanding of the teaching? So we're looking for correct statements. Correct statements only. While y'all are, since I just repeated that, I'll give you guys a few more seconds. We have a couple conferences already scheduled and a couple of booking a CLEXpert sessions already scheduled for this spring semester, which is crazy. I feel like we just hit the new year and y'all are already making us booked and busy. Love to see it. Thank you guys so much. But we also have conferences. We have NSNA. Where else? CS Canada. I don't even know the Canada one, but we're going to Saskatoon, Canada. So far up north, very cold. Actually, at the end of this month. New Jersey, we're going to New Jersey in February. So we're getting busy for you guys. Let us know if there's any other conferences you would like to see UWorld at, and we will do our best to be there for you guys. We love to say hi as well. I feel like this past year we got really close, which is really nice to see you guys in person. Someone says, wow, Saskatoon. Why not Toronto? I was thinking the same thing. I'm trying to go see Drake. Anyways, answers for this one would be options 3, 4, and 5. So we're looking for correct understanding of preschool age children. Option 3, my child should be able to independently turn pages of their favorite book. A 3-year-old, 2-year-old, 3-year-old, maybe even 4-year-old should be able to have that pincer grasp to turn pages. So this is a correct teaching point, or a correct milestone for a preschool age child. Option 4, my child should be able to communicate using at least 3-word sentences. Again, this is a true statement. They're developing and they're hearing more and be able to communicate what they want, what they need a lot easier. So stringing 3 words together should be expected from a 3, 4-year-old age. I feel like they are talking our ears off more frequently than that, actually. And option 5, I should encourage my child to assist with household tasks. This also helps with independency and just being able to be self-sufficient. So this is a correct thing. They won't be able to do everything, especially if it's weight-based, if it's something that's a little bit heavy to pour into like a smaller container, but they should be able to assist with a lot of other things that are less coordinated, like wiping down tables or carrying something to a trash or to the sink. Options 1 and 2 are incorrect. I should notify my healthcare provider if my child is not toilet trained by 24 months or 2 years old. Having a child potty trained at 2-year-old is very impressive. That usually happens a little bit later when they're more coordinated again, maybe towards the 4, 5, 3 if you're lucky. 3, 4, 5 is usually when you have a toilet trained child. 24 months or 2 years old is a little early. And then option 2, I can expect my child to be able to sit quietly for at least 30 minutes at a time. That wouldn't be happening, especially with a preschool age child. I don't even think a lot of adults can do that. So I don't think anyone chose option 2, which is correct, of being incorrect. Let's move on to question 6. The nurse is teaching a client who has a fractured right femur and is ambulating with crutches. Which of the following information should the nurse include? Option 1, place the crutches 24 inches in front of your foot when walking. Option 2, ask your caregiver to stand on your unaffected side when you're walking. Option 3, move your unaffected leg to the next step first when descending stairs. Or option 4, adjust the height of the crutches so the crutch pads are 2 to 3 fingers width below your axilla. Let me know what you guys think in the chat. I feel like with this one, you kind of have to act it out to better visualize what is actually happening. See about 24 inches in front of you, be on the affected side, kind of act them out. Also in the chat, we are way past halfway through, but let me know where you guys are tuning in from. I love to see how far UWorld reaches in the world. So whether you're here domestically, you're local here in Texas, or whether you're internationally, drop in the chat where you're tuning in from. I saw earlier someone was watching from Ghana, in Canada. I see California, South Africa, Jamaica, Massachusetts, Philippines, Mississippi, Nepal. Someone says I get confused with this topic. This topic is hard because it literally is most missed questions. So it's not a certain topic. It's just a whole bunch of hard questions. Zimbabwe, Atlanta, Haiti, Ghana, LA, Mexico, Canada, Liberia, Ohio, Puerto Rico. Someone said a good rationale. Good job, F. Grace. Detroit, Colorado, roll call, baby. Pennsylvania, Michigan, New Jersey, Wisconsin, South Sudan, Ghana, Dallas, hello, neighbor in Dallas, San Diego, Maryland, Turkey, Chicago, Tanzania, Sacramento, Washington. Thank you guys so much for tuning in, no matter where you are, local, international. We truly, truly appreciate it. If I didn't say it enough, we appreciate you 100K followers on TikTok or whichever social media platform you're watching us on. We truly, truly appreciate you tuning in to our live sessions. So, correct answer for this one would be option 4. Adjust the height of the crutches so the crutch pads are 2 to 3 finger widths below your axilla. So again, my strategy was to act this one out. 2 to 3 finger widths below your axilla. This would be a correct measurement away. So you're not putting constant pressure on the crutches on your axillary area, so you don't have any nerve damage or any injury in this axilla area. Yes. So 2 to 3 fingers kind of gives your arm and your axilla a break because it leaves a gap. So that is the only correct statement for whichever reason. You have to be very careful with measurements as well. Option 1, place the crutches 24 inches in front of your foot when walking. This would be incorrect because that's 2 feet. That's a big old step. I don't think anyone's stride, well, actually, if you're pretty tall, you might have a 2-foot stride. But for an average, a stride is at least 1 foot in front of you, or 12 inches. So with a crutch, you're also even more debilitated. So they usually say 6 to 10 inches only in front of you, since you are debilitated a little bit in whatever way. So 24 inches would be way too far in front of you and could cause injury and slippage. Option 2, ask your caregiver to stand on your unaffected side when you're walking. This would be incorrect. You want them as an extra support, an extra crutch. So you want them on your affected side as that support. Option 3, move your unaffected leg to the next step when descending stairs. So there's a little phrase that someone said multiple times in the chat. Up with the good, down with the bad. I have a little illustration here. When you're going up the stairs, you lead with your stronger leg, so you have more stability going up and more strength going up. And then when you're going down, you go down with your affected leg because your stronger leg can go in and catch anything that might happen if it's too weak to catch your fall. So up with the good, down with the bad. You can screenshot this little illustration for you to always, always, always remember, or just memorize the little phrase. Okay, last question of the day. The nurse and unlicensed assisted personnel are caring for assigned clients. Which of the following activities would be appropriate for the nurse to assign to the UAP? Option 1, assisted 2-day post-operative hip arthroplasty client with morning care. Option 2, collect a urine specimen for culture and sensitivity from a client with a Foley catheter. Option 3, irrigate colostomy of a 2-day post-operative colostomy client who is stable. Or option 4, refill the empty enteral feeding container with tube feeding. Let me know what you guys think in the chat. What can a UAP, your CNA, your tech, some places call it a medical assistant, what is in their role, their scope of practice? This one seems easy. It's very, 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 very unanimous in the chat. Good job, guys. Everyone is choosing option 1 because everyone knows that UAPs do activities of daily living. They do our routine care. They don't do any assessments. They don't do any crazy interventions. They do routine daily cares of helping them get ready for the morning, eating, ambulation, as long as it's not the first time ambulating. So assisting a 2-day post-operative hip arthroplasty client with morning care, this is the most stable and the least intensive type of thing to be doing for a client. So 2 days post-operative, so they pretty much have gotten up already multiple times to go to the bathroom and everything, so it's not a first assessment, and they're just doing morning care such as brushing the teeth, so no strong interventions being done here. Option 2, collect a urine specimen for culture and sensitivity from a Foley catheter. This would be incorrect. That is within the nurse's scope of practice or LVN, taking any sampling from the client. Option 3, irrigating a colostomy of a 2-day post-operative. You never want to have the UAP irrigate pretty much anything, especially something that is attached to the client. 2 days post-operative is a little too soon for a fresh colostomy, so that is incorrect. And then option 4, refill the empty enteral feeding container with tube feeding. Since it is a type of invasive feeding or line, that would also be up to the nurse or the LVN, because even though it is a type of feeding, it is an invasive line, so that has to be with an RN or LVN. So not so quite, but everyone pretty much got that one right. Good job, guys. Thank you guys so much for tuning in for another question drill. Today's was a little bit more tricky, but you seem to have got it a-okay. So I'm so proud of you guys. Thanks for tuning in and doing so well on today's question drill. Make sure to come back next week. We have more lectures and question drills multiple times a day, multiple times a week. Actually, we go live almost every day in the week. So go to uworldnursing.com to see our full event schedule and calendar and see what topics we're going to be covering on in the next couple of weeks. But until then, I'll see you guys later. Bye.